This is where we get to talk about the clinical features of iron deficiency anemia, or you could say clinical presentations. Okay, and clinical features is basically what the symptoms and signs combined together. Symptoms is basically what the patient will tell you, and the signs is what you as a medical practitioner will get to see when you try to like examine the patient. All right, these are things that are basically wrong with the patient, but the patient cannot really notice. Do you understand? So now, clinical features or clinical presentations of iron deficiency anemia. So the symptoms include fatigue, heart palpitations. And what is heart palpitations? Is basically like you being aware that your heart is beating. Okay, that's palpitations. Your heart is making like some loud noise. You have a poor focus. You have a restless leg syndrome. You have headaches. You have what weakness. You have what shortness of breath. Okay, now let's talk about it in full. Symptoms of iron deficiency. We have the symptoms and signs on this side. So for the symptoms, we have pallor. Pallor is like, okay, your skin can be so pale, all right, not having that bright color that you used to have. Then fatigue is being illustrated here. Fatigue basically like you'll be feeling weakness, okay, weakness in the body. Then lightheadedness. Lightheadedness, that should be like headaches. That should be like headaches. Okay. Then dyspnea. Dyspnea is what you have difficulty in breathing. Okay, difficulty in breathing. Then angina. Angina is like you'll be having some pains in the heart. Okay. The full name is what angina pectoris, which is described as what the pain of the heart and its great vessels. Then tinnitus. Tinnitus is a problem in the ear. Then palpitations, heart palpitations. Say, I see this illustration. All right, tell you that your heart is making so much loud noise. Then you have what glossitis. Glossitis is what inflammation of the tongue. Okay. Then pruritus. What is pruritus? Pruritus is itching. That's another name for pruritus. Itching of the skin. Then you have dysphagia. That's difficulty in swallowing, and this could be seen in what plumar vein syndrome. Then what about the signs? Okay, what are the things that the patient will not really notice? All right, that you as a medical practitioner will basically get to see them on what examining the patient. All right, you could see mouth ulcers. What is mouth ulcers? Basically, like some wounds in the mouth. All right, so basically, like tell the patient to open their mouth. Sometimes they can have these wounds, but the wounds will be painless. Do you understand? The glossitis too. Sometimes the patient might not notice that their tongue has some funny colors. Okay. Then angular cheilitis. Angular cheilitis, also known as what? Angular stomatitis, also known as what? Chelosis. It's like inflammation on the sides of the mouth. Do you understand? Anemic patients will have inflammation on the side of the mouth. Then Koilonychia. Koilonychia is a problem on the nails. You see the sides of the nails will be elevated and the middle of the nails will be like deepened. All right, this is a characteristic of what anemia. Okay, so now I think let's just have an overview on the symptoms again. Okay, in respiration you'll be having shortness of breath, that's dyspnea. In digestion you'll be having change in your stool color because iron is contributing to what the color of your stool. So then in the muscles you'll be having muscle pains. In the brain you can be fainting, that's syncope and fatigue. Then heart, you'll be having angina and heart attacks. Then for the spleen, you could be having a spleen enlargement. For the skin, you could be having what? A yellow coloration of the skin. Okay, so these are what the clinical features of iron deficiency anemia. Talking about clinical features, you are talking about what signs and symptoms of the disease condition. So that's it. I'll see you guys pretty soon.